So, those symptoms which can basically be explained under the lights of pathology and physiology, or the pathogenesis of that particular invaded pathogen, those symptoms are called as the common symptoms of the disease. Those symptoms will be common in each and every person having the same diagnosis. Like people who are having asthma, the breathlessness will be common. People who are having arthritis, pain in joints will be common. People who are having migraine, headache will be common. So these are the common symptoms of the disease. Getting my point? So far we have seen two set of symptoms. One are those symptoms which belongs to the patient, that to at a general level. It has nothing to do with what the local diseases or local symptoms are. And second are the common symptoms of the disease which can be attributed towards the activities of the invaded pathogen. So this is one classification that you have to keep in mind: symptoms of the disease and symptoms of the patient. Clear? I'll just give a pause for 2 minutes. Just close your eyes and rewind what we have discussed so far and ask yourself, have you understood what exactly it is meant by symptoms of the patient and symptoms of the disease, and then confirm.
One question is in my mind, sir. Regarding the symptoms of the patient, you mentioned only symptoms which are mental and emotional, and you didn't mention any physical, like modalities or something like this. Is it the meaning?
Coming to that only, sir. Next time coming to that only. Let others confirm that they have understood, then we'll move on to that. I hope it is clear for everyone what are the symptoms of the disease and what are the symptoms of the patient. Right. Now, even at local level, sometimes there can be some rare, peculiar and strange symptoms that belongs to the patient. Although it is only observed at that physical level, it is very peculiar and rare that it is then classified as the symptoms of the patient. How that symptoms appear, from where does that symptoms appear, that also we will see. Have a look at this video first. Just give me 2 minutes, friends. Net is little slow here. Now the monsoon season has started, so little bit of disturbance is there in the net connectivity. It is slow in uploading. Just wait. Hey friends, that video is taking too long to load. Anyhow, I'll give you another example. Say for example, friends, when you are at home. When you are at home, your home is under your control, right? How you want to keep your home, how you want to keep your bedroom, how you want to keep your kitchen, how you want to keep your dining hall, everything you know it perfectly, right? So when an unwanted guest comes into your home who starts misplacing things here and there, basically it disturbs you. Since it's a guest, you cannot throw them out because your parents have invited them. So you have to bear with that guest. So when they start doing things which you don't like, then how do you react? There can be different ways in which a person may react depending on their situation, mentality and mindset. Isn't it? So these are individual reactions happening at a local level in response to some local disturbance. Isn't it? Similarly, in any affected part, whether it be lungs, upper respiratory tract, or the kidney, or liver, when these invaded pathogens creates a disturbance and interfere with the normal functioning, at that particular localized level also some individualistic reactions are seen at a dynamic level. That reaction leads to or comes out in the form of maybe specific modalities, specific concomitants. So when a common symptom of a disease is accompanied by a very specific strange modality or concomitant, then it becomes symptom of the patient. Now for example, I'll give you an example, don't get confused. Breathlessness in asthma is a common symptom. If you consider 100 cases of asthma, 100 people will have breathlessness. But some people will have breathlessness aggravated early in the morning, some people have it aggravated at midnight, some people have it the aggravation towards the evening, some people have some other concomitants along with that, maybe vomiting or headache, some other thing. So breathlessness is a common symptom. It is a common symptom of the disease, but when it is associated or accompanied by a very specific and strange modality or a concomitant, then that symptom becomes symptoms of the patient and not the symptoms of the disease. Getting this point? So basically all the symptoms that you get after case taking can be broadly divided into two: symptoms of the disease and symptoms of the patient. As far as the selection of simillimum is concerned, symptoms of the disease has no role to play. So they can be easily eliminated. We don't want those. Say for example, after case taking you have got 40 symptoms, and out of those 40 symptoms, 25 symptoms are common symptoms of the disease. Eliminate them immediately and concentrate on the remaining 15. That remaining 15 only will lead you to the right simillimum. Getting my point?
So in this case, why it is in the repertory, all these rubrics like respiration difficult, respiration asthmatic, eruption, etc.
Now the symptoms of the disease will help you to arrive at a proper clinical diagnosis, because the symptoms of the disease are nothing but a group of common symptoms that belongs to that particular disease, and that is the basis on which clinical diagnosis is made, isn't it? So the symptoms of the disease will help you to arrive at a correct clinical diagnosis, whereas the symptoms of the patient you have to further consider for the evaluation and analysis to construct your totality, right? So how that is done, that we will see tomorrow. So thank you and good night to all. We will continue from here tomorrow. How was today's discussion? Please let me know. We will come to that, sir. We will come to that when we will be discussing on constructing the totality or image of sickness, and we will be coming to that in another few days time. We will reach there. So by that time we will discuss why these common symptoms are given in the repertory. Are you getting a feeling that this homeopathy is something totally different than from what we learn from our colleges?